Welcome to Senior Stay or Go TV, a show to educate, entertain, and advocate on behalf of our aging adults. We are here to provide you the best information for your quality of life.
Welcome to Senior Stay or Go TV. During the COVID-19 virus, we have been fortunate to have a number of guests on our show, and today we're fortunate to have Tim Washburn from Electronic Caregiver. Tim, I know that you are the Chief Clinical Officer there at Electronic Caregiver, and you've been a nurse and a nurse leader for over 25 years. So why don't you tell us a little bit about yourself and why you moved to Electronic Caregiver?
Sure. Thanks. Well, first, thanks for having me here. This should be fun. It's nice to get out virtually since you really can't any other way right now. I've been a nurse and I've done a lot of different things. Everything from home health aid all the way up to bedside nursing, all different kinds of leadership, different settings. I really made a decision after meeting Tony Dorman, our CEO at Electronic Caregiver. After meeting him and understanding his vision, which really aligned with something I'd seen over time, which is there's simply not enough nurses and doctors, and there's never going to be. And, a couple of decisions healthcare has to make. Are they just going to keep trying to work harder, which is obviously not really going to work over time, or are we going to work smarter? And so after meeting Tony and seeing his vision for his products that we have now, and then Addison to come, I was like, wow, this guy gets it. So he kind of poached me. The running joke is he stole me from the hospital, and it's pretty true, actually. But I came over because I believe tech is the answer to really promote healthcare in a meaningful way and to go from episodic care to real 24/7 telemonitoring, telemedicine to create a much better overall care system. So it's really been a wild ride. It'll be a year on May 6th. I will be at ECG, and it's been awesome and busy, but good.
And I can only relate to what you're saying about episodic. I took care of my parents there in Albuquerque for 12 years by flying once a month for a week and lived through an enormous amount of episodic.
Yeah, it's a real, COVID-19 is obviously bad. If there's anything good about it, perhaps it's that we're taking a little more seriously infectious disease, and we're starting to understand that reality is just because we've always done a thing doesn't mean it was always best. And there's really ways to leverage technology without destroying that physician relationship or that hospital-patient relationship that really optimize outcomes and care while still minimizing risk. And we're going to talk a lot about that as my guess. That's kind of what we specialize in. So the timing is perfect for us to implement these things.
So with COVID-19 once it began and spread across the country, Electronic Caregiver was quick to get into action by using some of your technology, both with the business side of things as well as with your own employees. So you want to tell us a little bit about that?
Yeah, so Electronic Caregiver, we have technology and have for nearly a decade. Technology that can go into a patient's home and provide some safety and monitoring and reminders and different things. When COVID hit, being a nurse for a long time, kind of all looking around the table at the leadership level going, oh boy, we are an essential business. We have thousands of patients that rely on us, folks at home, to stay at home safely. So we had to figure out how do we keep folks that have to be here. So though we did social distancing, all the things you've heard, but we took our technology and we re-architected a little bit. And the idea is we're able to have our employees with our tech. We're able to have them take their temperature, use AI algorithms to identify risk, to create an alert that goes to a supervisor who then has a conversation with that employee, see what's really going on. And then importantly, we added our telemedicine service. So if there's any kind of an issue in real time before that employee even leaves their home, we can get them a telemedicine visit. That doctor can actually prescribe medication or make recommendations about staying home and such. So fun fact, I guess, if you're looking at outcomes, which of course I do, I'm one of those weird nurses that like math, go figure. We've had, knock on wood, we've had 0 cases of COVID-19 in our workforce. We've had 0 cases of folks who didn't feel good, who came in and then found out later they had COVID. we've had cases where folks don't feel good, or they've had a temp, they don't make it in the door, they're home. And by the time they get here, they've already figured out, we already know, do they have anything? And so we've been very lucky, but it's been intentional. Employee health is this thing that should matter, not just during COVID. The flu is coming, and it costs about $87 billion with a B dollars a year. So what I'm hoping is this telemonitoring, this healthcare, this employee protection that we're doing, and we're working with other companies to get them to do it too, will stay in place for a while, and perhaps we can kill less people with the flu, and perhaps we can spend less money on the flu because we're doing some of the things that we've learned to do in COVID-19.
Tim, Patty and I are here in San Diego, and we specialize in working with seniors as realtors, and we've initiated a program called the Senior Stay or Go program. Because we know that 97% of most folks want to age in place.
Sure.
And that's what we really have a lot of referrals to. So tell us how your product can support seniors who wish to age in place.
Sure. Well, we have a couple of different products right now, and we have another one coming out in July. I'll tell you what they share in common first. So all of them have personal emergency response built in. So if you are living alone, it has both a like a panic button, but the device itself has a button. So you can call and get real immediate access through the device to Rapid Response, who is our PERS partner. So all of our system has PERS. A lot of folks will say to me, well, Tim, but if I have a cell phone, I can dial 911. Well, that's great if you happen to have your cell phone and the dog isn't biting on your neck, or you haven't fallen and broken your cell phone. True story, my mom, really strong lady, lives alone in upstate New York. She actually fell, broke her hip, crawled 50 yards in the middle of winter to get to a phone, then waited 30 minutes for EMS to get there. So she now has our stuff. And so if that were to happen again, she hits a button. She doesn't have to go anywhere. She talks to the people if she's next to the device. If not, they roll EMS anyway. And now help is on the way, and you don't have to worry about it. So PERS is just part of what we do. The other things that all of our systems include are medication reminders. So, we know that non-adherence accounts for about 50% of all issues in healthcare. So our goal is to remind folks it's time to take their medicine. As folks get older, and I'm including myself in this because I seem to be forgetful lately. That may be the job, I don't know. Could be, but it's nice to have that reminder. It's time to take your medicine. It's time to get up. It's time to go to the doctor's office. So we have all of those things too. So the idea is we engage. We engage through simple to use technology that can provide safety, some medication reminders. All systems do that. Pro Health adds the piece where we can actually have a device that has peripherals attached. So Pro Health is the great system for chronically ill. We work with a lot of physicians, a lot of remote patient monitoring companies, a lot of accountable care organizations, starting to work with some insurance companies. And the idea is, let's check your blood pressure every day, and let's notify the doctor in real time if your blood pressure is out of whack, so that doctor or the nurse or the case manager can reach out to you, identify that issue, engage immediately, and prevent you from crashing and ending up in the ED or urgent care. That's the goal, right? We want to, in order to age safely in place at home, you need connection, you need care, and you need simple to use real-time access. The care team around you must be able to connect with you. We build our devices intentionally simple to use, and we've seen great success with that. So those two devices really work on that whole engagement aspect. Coming soon, we'll have Addison Care. She'll be basically a virtual caregiver. So she'll have a camera, like I'm looking at. She'll have a camera. She'll have a far-field mic. She'll be able to evaluate your gait passively. Same idea in terms of if we see a change, notifying the care team. So really, we're taking it to the next level with Addison, and she's going to be fantastic. Can't wait to do a demo.
We do want to ask you that you also add an Adam to it.
Well, we haven't seen Adam yet. I don't know. I guess on a bad day, you could call me Adam. I don't know.
I guess the only reason we say that is because in the 10 to 12 years I took care of my mom and dad, my dad refused to have a female caregiver.
That's funny. We are going to have It won't be love. It won't be genuine. We are going to have different voices and different personas. Because you know what the reality is? This is a device. Addison's going to be a virtual 3D caregiver on a tablet-like device. So it does matter, if you don't want a female or you don't want a male or you have a certain preference in terms of ethnicity, in terms of who you interact with, we'll manage that too. I mean, it's your home. You should have the right who's in there, right? I mean, that's kind of it's your call. You're paying the rent, as they say.
Exactly. Well, with telemedicine being the buzz, having just experienced that myself personally, you guys have specialized in telehealth for quite some time.
Sure.
Are you seeing that change being more acceptable? What are you seeing these days?
Yeah, it's funny. We see people who, elderly folks who didn't like technology suddenly being more comfortable. And the other interesting thing is we see younger folks who really like technology suddenly craving interaction. So, COVID is, look, at the end of the day, COVID is the disease today. There will be others. The flu is around. I don't think we're ever going to get away. I was actually talking to a pharmacist or a lab company, and I'll talk a little bit about that partnership. And we're talking about the different levels of immunity and what are we seeing. A lot isn't known about COVID. There's still things we don't know. It's an interesting disease and it does kind of crazy things. So I don't think COVID's going anywhere. I think to your question, telehealth is here to stay. I think what's interesting is we're seeing more understanding of what telehealth is, both from providers and from patients. And telehealth is this global term that's frankly misused frequently. So really, telehealth consists of telemedicine. That's where you get on the phone with a doctor or maybe through something like this, and you have a consultation with that doctor. That's really telemedicine. A provider is doing episodic care with you. What's the difference between telemedicine and traditional care? Where you are. Same idea, it's still episodic. And we know that generally Americans aren't overly healthy, just being honest, because we seem to have this penchant for not wanting to pay copays. Totally understood. I agree. But telemedicine is different than telemonitoring. So I think what's really unique about ECG and what we're seeing out there is folks are starting to understand that you need both. They're starting to understand that telehealth isn't just this one thing. Telehealth with real-time 24/7 monitoring and telemedicine is actually a better form of health in many ways for many people, because now you don't have to worry so much about the copays. You don't have to worry about spending 2 hours in a doctor's office. You're not next to the child with the flu, coughing and hacking, all of those things. So we're seeing that COVID has been a good catalyst for a better understanding of telehealth, i.e. telemedicine and telemonitoring. We're certainly getting a lot of interest. My day is full of calls and talking to doctors and ACOs and MCOs and EIOs and name one, they're coming out of the woodwork. I think it's good that we're moving this way. I think that if we learn this lesson and apply it to influenza and other diseases, we will actually make a difference in influenza death too, which I'm, as sad as I am for what's happened to get us here, I'm very excited about this new awareness. And it seems to be across not just the private industry, but the government too, which is fantastic. It's about time, frankly.
Tim, do you think there would be a day when there'd be a Zoom conference and a physician would allow the patient, the patient's spouse, the pharmacist, and the physician to be on a call at one time?
We already see that a little bit, and that's a fantastic thing. I absolutely think there will be a day. There's some technical challenges with that. There's always, HIPAA and privacy, and everybody's concerned about it. I use the analogy when it comes to HIPAA, which I love, and I respect. I'm the HIPAA privacy officer, so if there's an expert, I guess I'm it. But the reality is we spend a lot of time in healthcare keeping folks' information private, not nearly enough time sharing that information strategically with the care team. So to your point, will we see Zoom fill, and not Zoom doesn't have the greatest security, so there's other.
Right.
Whatever.
Happy to share that with you before you get on Zoom. But yeah, I think you are going to see that for sure. And actually, that's something we'll be working on internally. We believe that our health technology, without the right connection and the other services to really get that information back to the entire care team, is frankly an expensive paperweight. We don't sell expensive paperweights. That's not our focus. Our focus is on solutions. The technology is really the easy part, frankly. All those connections, integrating with other partners, bringing in lab companies and RPM companies and the doctor and the family, that's the stuff that is the secret sauce, and that's what we specialize in.
RPM being, what does that mean?
Remote patient monitoring. So we could go along. Anybody, do you guys know what remote patient monitoring is? Do you want to learn about it?
Sure.
So Medicare came out in January 1 of 2019 with codes related to remote patient monitoring. So for Medicare beneficiaries with at least one chronic illness, the government on Medicare patients will actually pay the bulk of the fees related to our ProHealth technology. Has to be ordered and managed by a physician. But here's a fun fact for you. Even with COVID, before COVID, doctors that did remote patient monitoring for their patients would get revenue. They're guaranteed to get revenue. The patients are guaranteed to get technology that could monitor temperature and O2 sats and several other things, right? And then the family can get included in that access to a family caregiver app that allows your daughter or son in real time to know exactly what mom or dad's temperature was. So it's funny on COVID, you know, we happen to be very well prepared. Everything we do literally fits into what we need to do with COVID. Very small pivot for us. So there's folks out there who don't realize if they're on Medicare, they already have a benefit that can cover chronic illness management through their doctor if they order it and participate in that service. And they pay very little.
Are you defining chronic care as cardiac care, diabetes, or does it include Alzheimer's?
It does. It includes all those. So the government defines it fairly globally. It's got to be something that is believed to be last longer than 6 months. It has to be something that impacts care. But I'll tell you, the average doctor has at least 300 patients on Medicare in this country who would qualify, and based on our statistics, because we've been doing this for a while, not only would qualify, but patients would say yes, and they will use it. So if they should call me.
And as us baby boomers age, we hopefully will be more adapt to the technology.
Well, the beauty is for the patient, literally, you plug in the device, you turn it on, and it does everything else. When you take your temperature and you turn on the device, it automatically pairs the device, it automatically gets the data, it automatically sends the data, the alert, if needed, automatically goes to the doctor or care team member. The patient has to do nothing but take the vital. That's it. That's intentional. That's how we wanted it designed.
I mean, has CDC, Mike Pence reached out to you? I mean, where are we with, this?
It's a great question. One of the reasons we do these kinds of shows is we would love to reach out more. We reach out through our partners and directly to a lot of folks. Right now, I just can't imagine working in the CDC. I mean, my job is busy. Their job is, I don't even know. So we do reach out. We would like them to reach out more. I would anybody listening, look, here's the fact. We literally can make a difference in saving lives and have been. Not only with COVID, but for chronic illness. So there's no good excuse not to reach out to us if you're a clinician looking to help your Medicare patients or any patient.
I will tweet this to @you-know-who.
Please. Yeah, I mean,
he's on Twitter and he's talking every day, so we might as well get it in front of him. And at electroniccaregiver.com, 833-324-5433. So
yeah, and I'm happy to give my cell number too. Turns out there's no rest for the wicked. So I carry my cell phone everywhere. So if you guys want that, I have no secrets. Let's go. My whole job is protecting people. If I'm not doing that, I should be fired. So far, they haven't fired me. So it's good. We're hoping.
So what do you see for the future with remote patient monitoring and Addison that's going to be available in July?
Yeah, I think that we're going to see more of the same. I think that we're going to see a lot more folks understand the importance of health maintenance. We've used the word wellness for so long, it no longer means anything. But at the end of the day, you can't engage. Remember, healthcare is a personal choice. Everybody listening, one choice at a time decides, will I smoke? Will I drink? Will I check my blood sugar? Right? The problem is we've defined in the healthcare industry that non-compliance is the issue. But I'm going to tell you the truth because I've been at this a long time. There are certainly some folks who are non-compliant and will not choose. But for the most part, it's really, in my mind, a systems problem. Imagine for a moment someone who should take care of their diabetes. In order to do that, we're going to have you go to the doctor's office and wait 2 hours in a crowded waiting room where you might get sick. And then you're going to see the doctor for 3.5 minutes. And we wonder why wellness doesn't seem to be first on that person's mind. What if we could switch the paradigm? What if we could use telemonitoring to engage easily at home? Get that data to the doctor. Based on that data, really define when that patient should come in and what that patient needs. So the visit isn't about reviewing a list of data. It's actually about reviewing the care plan and looking back that 30 days to see what's been going on so that together we can plan. I mean, that's really what I see as the power of telehealth. What do I see in the future? I see people demanding that. I see people absolutely demanding and not accepting, I'm going to go get flu from the 9-year-old next to me. Because you know what? We don't have to. That is a choice. I think we're going to see more of that. I think you're also going to see a pivot on the employee-employer relationship. You know, I was working with a very big meat-producing company who I shall not name. But, you know, they've been shutting down plants. And, you know, that's the food supply guys. I mean, one plant that they shut down, my understanding is represents 4% of all meat production in the United States. So even though we're talking about telehealth, telemedicine, telemonitoring, what we really need to be talking about is wellness at home, interacting in real time. And we've got to move that to the employee-employer relationship too. It does me no good if half of my employees are sick, whether it's flu, COVID, whatever, and I don't know about it until they're in there infecting the other half, and then I have to shut down my plant. So we as a company are pivoting a little bit to re-architect and reorganize a little bit to not just help elderly and safety at home, but to broaden that definition to apply that to the employee-employer relationship. I think that's the other shift you're going to see. I think you're going to see a lot more of that.
That's applied to the teacher and their children going to school.
Absolutely. Yeah, I mean, at the end of the day, you know, this is pretty easy, right, guys? Either we do a better job of prevention or we're going to have more people die. It is that simple, and it's high time. So like I said, if anything with COVID, I hope folks hearing this, especially clinicians, realize there are better ways to do it, and we can prove it and show you.
You also mentioned something about the pharmacists. So what we see, or what I saw even with my own parents, is, you know, we have become a community of going to specialists. So you have your heart specialist, and you have your kidney specialist, and you have all your specialists. And one doctor prescribes one thing, and another doctor prescribes another thing, and before you know it, you have this plethora of medications you're taking that one may counteract the other, and sometimes the pharmacists catch it, sometimes they don't catch it. Sure. Is that going to be part of your telemedicine protocol?
So right now, through our telemedicine, we do have access to pharmacists. So that's part of it. And that's cool. You know, the really nice thing, I think the really powerful thing is, typically speaking, the older you get, it seems to be the more meds they try to put you on. Just
right.
Put it out there. So the great thing about Medicare's remote patient monitoring codes is there's actually an ability. We partner with companies that specialize in providing case managers whose only job is to do clinical outreach and review the care plan of the patient. And part of what they do is look at the meds. So the idea is, you know, not everybody's a pharmacist, and God help you trying to keep up on all the meds. I mean, you know, it's supposed to cure one thing and it has 77 side effects, including death and, you know, fainting, right? So you can't drive, maybe you can't live. I don't know, you know, pick one. But the idea is for those doctors who enroll that Medicare patient, they're going to get a care team. We have the ability for them to get a care team, and it's all covered and sustainable under the current Medicare reimbursements, right? They're able to get a 24/7 care team that literally is required to spend 20 minutes at least a month reaching out, communicating with that patient, going over things like meds and vitals and what's going on at life. It's amazing because literally it's a benefit that the government already says you have access to, and the only reason you may not have it is the doctor may not know. He can participate because he hasn't talked to me yet. But absolutely, medication reconciliation, wellness visits, transitional care management, all of these other things, you'll see a big play in that in telehealth, and we will be working through those as we get closer. One thing I wanted to add about is, it just happened today, but we will be partnering with a lab company, so we'll have the ability to do actual lab testing through this partner, and folks will be able to do that testing at home. So imagine for a moment, we think you might have an issue. We get you hooked up with a doctor to do telemedicine. The doctor says, yeah, I think you may have COVID. Now, most of the time they don't say that, to be clear, but if they do, the ability to actually set you up with a test too. So now you can self-quarantine. We'll be able to get you a test in your home. You'll be able to do the test, send it back to the lab. 4 or 5 days, we know if you actually have COVID or not. So instead of quarantining yourself for 14 days, now maybe you have to quarantine for just that time until you get the test back. Things like that, those partnerships with different specialists, we do that all day long, and we have lots of options.
And your services are across the country. Are they outside of the country?
Not yet. Not yet. There's I don't know if I'm allowed to say the organization. Let's say there's a big organization globally that focuses on health. And we were supposed to be going to Germany in May. It's on hold, but it's still progressing. So yeah, we're going to be working in lots of other countries.
And you said you wanted to give out your cell number, and we got to get close to wrapping it up. So if you are willing to do that on camera today, then go for it.
Sure. Do you want it now? I mean, I have no secret.
Yeah, sure.
So the cell number is 575-528-8809.
Well, we thank you for your time. Electroniccaregiver.com. It's a great website. Addison and I are already really bonding pretty good. You gave out your cell number, also 833-324-5433. I encourage, Patty and I work with senior communities. I think that's a great market that everybody should be calling you about as well. We thank you for, we think it's a revolutionary time. The revolution time is over. It's now.
Mm-hmm.
I mean,
right.
You can't let the 50,000 plus people that have died with COVID die in vain, if you want to put it that way.
Agreed.
They have revolutionized the healthcare industry moving forward for the better. So we thank you for your time. Patty, last word?
Just, is there any one last statement or comment that you would like to make, Tim? Because we really appreciate your time today.
I guess I would just say, it takes a village. At the end of the day, the airwaves are just flooded, frankly, with a lot of misinformation, sadly, with a lot of drama. At the end of the day, what I would say is there are ways that we can all do a better job preventing illness and managing illness. As a community, this is the time to come together and create solutions, not barriers, not walls, not drama. I believe this is a defining moment for our country. I think there's an entire, probably several generations, that this is the time they get to step up. It's going to be a little different. It's going to be a little scary, and nobody knows for sure the future, but we know this. As a country, we are far more capable together. And healthcare is this thing that we take for granted. We're going to have to roll up our sleeves a bit. But I'm excited for a new future where we do a better job, and I invite everybody to take that journey with us. I think it's important.
Awesome. Thank you for being with us today. We're going to get this out to a lot of people for you.
All right. Thank you, guys.
Thank you.
Have a great day.
Have a great day.
Be well.
Be safe. Bye-bye.
Bye-bye.